Time for Night Court. Packed away in Oregon's budget is a controversial measure on what are being called universal home visits. Well, this proposed law could allow in-home visits by Oregon health officials to all families with newborn babies. 18 lawmakers are calling the bill an emergency measure, arguing it's necessary for preserving Oregon's public health and safety. Some residents say it's straight up Big Brother. Tonight's Legal Eagles, two of our favorites, are here to debate. Criminal defense attorneys Bob Bianchi and David Bruno. Gentlemen, welcome to you both.
Hi, Shannon.
Hello, Shannon.
Okay, so let me start with what we have here, a little bit from the bill. It says this is Senate Bill 526. It says this 2019 act being necessary for the immediate preservation of the public peace, health, and safety. An emergency is declared to exist, and this 2019 act takes effect on its passage. Which one of you thinks this is an emergency, if either one?
Well, Shannon, I think what they're doing there is they want to move this legislation quickly. No pun intended, but they've already taken baby steps with this. Lincoln County has already had a pilot program. They've gone very slow and steady to ameliorate any fears that people have. And at this point, they're saying, let's put a committee together. It's for the health, safety, and welfare of these children. Let's call that an emergency. If we could save one child, let's do it. And so you have to the end of the year. It's just really a legislative tool to get there sooner than later. They've already done this for over a year in Lincoln County.
Okay, so we have Patrick Allen, Oregon Health Authority Director, saying this. He's quoted as saying, this isn't something for people in trouble. This is stuff all kids need, stuff my kids need. David?
Yeah, what they're requiring is that this is going to happen for every single child, and that's just not compatible with United States Supreme Court precedent. It's been found that this parental interest in the care, custody, and control of a child is perhaps the oldest and most fundamental liberty interest under our 14th Amendment. It's not going to pass constitutional muster. For every single parent to be invaded on their parental interests, it's just not going to happen.
Well, in an article written about this by PJ Media, they say this: government agents monitoring the homes of law-abiding parents who have not been accused of a crime without a warrant is an unconscionable violation not only of parental rights and individual liberty, but also a trampling of the Fourth Amendment and the Due Process Clause of the Constitution, Bob.
Shannon, I'm all for the Fourth Amendment due process, but unfortunately, with respect to the author of that article, and in Lincoln County, which has already been the beta site, that is not what is happening. They are not busting doors down. They're providing an opportunity for nurses to do pre-screening, immunization, to get them primary health care, and to help them with any issues that they may have on 2 or 3 visits. And there's nothing that we know of right now that's mandatory. The reason they're upset, the author of that article, is because people use the term universal, and they said, well, you know what that leads to next. Yeah. I agree. If they go breaking your door down or mandate it, that's a problem.
Okay, apparently they're considering this in Washington State, too. The governor there says, my budget would also offer universal home visits. This gives every new parent the opportunity to get a visit from a nurse during the first few weeks back home with their newborn to share important information and build confidence. David, that doesn't sound so bad.
Yeah, but Shannon, I think what needs to be clarified in both these states is when you talk about universal, is it mandatory?
Right. That's a big sticking issue,
yeah,
I think, for everybody.
I think it's a good idea, but you have to opt into this. I mean, who's going to deny free health care if that's what's going to be done? But how is this going to be paid for? Who's going to pay for it? It's going to be the taxpayers. It's going to come in an increase in taxes, and they have to generate the revenue to provide these services. Well, so I disagree.
Yeah,
I disagree with the principle.
I'll tell you what, though, Dave and Shannon, this pilot program, the governor, the Director of Health and Human Services, bipartisan support with 18 people that signed on to this bill. So they must see something there that they like.
Well, and opponents see Big Brother. So we will leave it there. David and Bob, thank you very much for presenting the arguments here. And folks at home, you are our jury today. So let us know what you think at Shannon Bream or at Fox News Night about these visits to your newborn baby.